In a shocking turn of events, the leading health agency in the United States has made the controversial decision to permanently terminate the employment of 600 individuals at the Centers for Disease Control and Prevention, CDC. This information comes from a union that represents these workers, highlighting the gravity of the situation. Many of those affected had already been placed on paid administrative leave as part of a larger plan for mass layoffs proposed by Health Secretary Robert F. Kennedy Jr. back in April, according to the American Federation of Government Employees, AFGE. This decision marks a significant shift within the agency, impacting various divisions, including the Division of Violence Prevention and the Office of Equal Employment Opportunity, as confirmed by the union. The timing of these layoffs is particularly troubling, occurring just 2 weeks after a tragic shooting incident at the CDC's Atlanta headquarters, where a gunman unleashed a barrage of 500 rounds, resulting in the death of a police officer. The AFGE expressed deep concern, stating that these firings only add to the trauma experienced by CDC staff following the violent attack. They argued the cruel decision to move forward with these unlawful separations immediately after a violent attack on campus contradicts their stated commitments to promote the recovery of CDC staff and undermines the stability of our agency. The U.S. Department of Health and Human Services, HHS, has confirmed the firings to the BBC, referring to Kennedy's earlier announcement in March, where he indicated that a total of 10,000 workers would be laid off across various health agencies, including 2,400 at the CDC, as well as employees at the National Institutes of Health, NIH, and the Food and Drug Administration, FDA. Following the announcement of these layoffs, many CDC employees found themselves on paid administrative leave while legal challenges to the firings were addressed in court. Recently, a federal judge in Rhode Island modified a previous order that had blocked the administration from terminating any CDC employees, now only prohibiting HHS from firing staff from 6 specific divisions within the CDC. In his announcement regarding the mass layoffs, Kennedy stated that the objective was to eliminate bureaucratic sprawl and to refocus the agency's efforts on tackling the chronic disease epidemic, which he has identified as a top priority. He claimed that these firings would result in significant savings for taxpayers, estimating a reduction of $1.8 billion, $1.3 billion annually. The layoffs have affected a wide range of employees, including those involved in the government's response to infectious diseases like bird flu, as well as researchers focused on environmental hazards and those managing public record requests. Since taking office, Kennedy, who has been critical of vaccines, has implemented several funding cuts and changes to the way the U.S. recommends and regulates vaccinations, actions that have drawn ire from public health experts. Just this week, over 750 former and current HHS employees sent a letter to Kennedy, accusing him of inciting violence against public health workers in the wake of the CDC headquarters shooting. They argued that his dissemination of vaccine misinformation and the fostering of distrust in public health have led to increased harassment of health officials. Investigators have revealed that the individual responsible for the shooting, who ultimately took his own life, had expressed that he believed a COVID-19 vaccine had contributed to his feelings of depression and suicidal thoughts. This tragic incident raises important questions about the impact of public health messaging and the responsibilities of leaders in the field. What do you think about the recent layoffs at the CDC? Do you believe they were justified, or do you see them as a harmful decision in the wake of recent violence? Share your thoughts in the comments below.